Are you new to Dubai? Are you considering taking a health insurance policy? Then you have come to the right place. Today in this video, we will be discussing about why you need to take health insurance policy and what you need to consider before taking one. I'm Dr. Neha Lalla, your gynec expert at Prime Hospital in Dubai. Not only health insurance is necessary, but it is mandatory in UAE, be it citizen or expats. Why is it so? It is because of the rising cost of health services. If you go to the outpatient or inpatient services and do not have health insurance, then you will end up paying a hefty amount for the services. So for that, you should consider taking health insurance policy beforehand. In cases of employees, like for companies, the companies have to take health insurance policy for the employees. However, all companies may not take health insurance policy for the spouses. In that case, you need to consider policy for the spouse and the children. And in case you are running a business, then of course you have to take your own health insurance policy. Why I am stressing on the fact that you need to take health insurance policy? Because I am seeing many ladies or young girls landing up in the emergency or coming with early pregnancy complications, coming up with pregnancy remaining in the tube, which requires surgery for removal of the tube, or coming with severe abdominal pain, which is due to twisting of the ovarian cyst or rupture of the ovarian cyst, which requires hospitalization, requires urgent surgery, and in this case you end up paying nothing less than 20-25,000 to the hospital. So before you land up in any such situation, before you need health services, we always think that it won't happen to us. We won't need it. However, there may be a time when we actually need it. So it's better to be prepared, be cautious, and to have health insurance policy in advance. What should you consider while taking any health insurance policy? You need to check for the coverage. That is, what kind of hospitals are covered in the network. At least some hospitals in your locality, which are good ones, should be covered in your health insurance policy. Also, you should check whether the outpatient is covered in the hospital or only in the clinics, because in some policies only outpatient is covered in the clinics and inpatient, that means hospitalization, is covered in the hospitals. Whereas in the policies which are slightly expensive, outpatient and inpatient, that means routine OPD and hospitalization, both are covered in the hospitals. Check that before taking any policy. You should also check whether maternity is covered or not. Generally, maternity is covered after a wait period of 6 months. That is important for ladies to know who are considering childbearing or considering getting pregnant. Any predisposed condition or conditions which are existing from before are generally covered after 6 months. However, if you have any pre-existing condition like diabetes, hypertension, if there is any fibroid which you already have which might need surgery, kindly disclose it while taking any health policy, because once your 6-month waiting period is over and you go in for the procedure or go in for surgery or go in for any kind of treatment, it may get rejected. The claim may get rejected, stating that it's a pre-existing medical condition and was not declared at the time of taking the policy. So be very careful while taking any policy. Also, eye and dental services are generally not covered by policies, and they will be covered only after you pay a nominal premium for that. So be aware while taking the policies and do not neglect your health, protect yourself, and hope for the best. Bye.